Hello, I'm Jason Howland. Welcome to Speaking of Health, a place to help you learn how to live a longer and healthier life. You or someone you know probably has felt a little blue or down in the dumps, especially during the winter season. Depression is very real, and it can be very serious for some people. And the shortened days and lack of sunlight as we are shut indoors during the winter, well, that can make the problem stand out even more. Our guest today to talk about seasonal affective disorder, also known as its acronym SAD, is Meg Stump. Meg is a behavioral health provider from Mayo Clinic Health System. She is a licensed marriage and family therapist and a licensed professional counselor. Meg, thanks for joining us today.
Well, thank you for having me.
Before we delve into the topic of seasonal affective disorder, let's start out by talking about depression in general. Is it as common as people, or more common than people might think?
I think it is. I think it's not only as common as people think, but probably more so. They are now determining that an estimated 19 million Americans have struggled with depression. It will likely affect 25% of women and at least 12% of men. Quite honestly, I think it's probably more like 25% of men, but only half of them are admitting to it.
And do you think that the diagnosis of depression, we're better able to diagnose it? People are more willing to come in to actually be diagnosed for depression, is why the number is growing too?
Depression is growing for reasons they don't really quite understand. From what I've read, in each generation since World War II, there's been almost a doubling of incidence of depression.
Wow.
So it's very much more prevalent today than it was in the times of our grandparents or great-grandparents. On the other hand, we are able to talk about it more. We're able to understand a little bit more about what's happening, and we have much better interventions for it now.
So what are some of the common signs of depression?
The most common signal for depression is a sense of feeling sad or irritable. But right up there among that is a loss of pleasure. And it's almost a sense of loss of joy in things that used to be really enjoyable to a person, which will strike them as very strange, as though there's been a great loss. Also, changes in sleep. For some people, they are sleeping more. For many, though, they find that they're not sleeping as well. They're waking several times. Very often, if they're not feeling well, then there'll be worried thoughts as well that sort of sneak in the middle of the night. Other signs of depression: feeling tired, feeling worthless or guilty, having a sense of fatigue. There's a sense of withdrawal, so that people as they become more irritable and sad, they're less likely to be involved with other people. And a concern can always be that for some people there'll be suicidal thoughts. And that's very much a function of depression. That comes with it, like a fever comes with the flu.
So what causes depression? Is it something that you're just born with, or is it caused by stress in your life?
It's not entirely known. We don't quite understand depression yet. You're certainly not born with it. And at times, people struggle with an enormous amount of stress and have no trouble with depression. At other times, they can run into a situation where there's loss and stress, and depression shows up as well, and it's not clear why it happens sometimes and not others. However, there's lots of studies about it, there's lots of talk about it, and the upside is that we're getting better at recognizing it, we're getting better about talking about it, and we have much better interventions available. And that includes antidepressant medications that simply weren't available to people 30 or 40 years ago.
Let's go on to seasonal affective disorder, what we talked about at the top of the show. Is SAD, is that a form of depression?
It very much is a form of depression. But it's very specific to, I almost wanted to say it was specific to Minnesota, but that's not true. But it's specific to a certain pattern that comes about when light begins to diminish for some people. And I use the example of a bear. Think about a bear in the fall. what happens? They get very irritable. They're getting grumpy. They start carb loading, and they get very sleepy. They really want to spend all their time eating and sleeping all the way through the winter. And for some people, they have very similar response, that when the light begins to diminish, they're more irritable, they want to eat more carbs, they want to sleep more. But the problem is that unlike bears, we have families, we have jobs, we have to engage with people, and if we simply give in to that urge to be grumpy and sleep, we'll become more and more depressed.
So with the winter season, is seasonal affective disorder, is it the lack of sunlight, the cold weather, the shortened days, is it a combination of all of that, or?
It seems to be a physical response to the shortened days. In other words, there's less sunlight, but more than that, there's actually a pattern of shorter days, and that affects us very, very much. I know that it gets very complicated. The two pieces I kind of know is that as we lose sunlight, we see a drop in serotonin, which is a neurotransmitter that leaves us feeling kind of joyful and giddy. But we also see an increase in melatonin. People might recognize that as a neurotransmitter that encourages sleep and sleepiness. So if it's dark, we have more melatonin, we want to sleep more, and that discourages even further our ability to get serotonin.
So how do you diagnose someone with SAD?
Well, there needs to be a regular pattern of this kind of depression that falls within certain seasons. In other words, when the light's diminishing. And there have to be a number of symptoms, and it has to be causing a person a problem. Because let's say that a person is struggling a little bit but is handling it well. We don't want to be diagnosing them with a problem unless it really is a problem for them. For it to be SAD, you're going to see it several years in a row, so that there's going to be that regular pattern, and you're going to not have any problems with depression at other times of the year.
So Meg, besides moving south near the equator, which most of us probably aren't able to do or willing to do, how do you go about treating seasonal affective disorder?
The most important piece to remember is that we need to do things that are the opposite of that urge to stay in the dark and sleep. And that means light and exercise. So the best thing you can do is get outside, get a lot of light in the daytime, and if at all possible, exercise as well, which has an incredibly positive effect both for seasonal affective disorder as well as regular depression. So that can be the first thing. However, there's limits to how much I can recommend people to go outside and take a walk in this kind of weather.
Because it's so cold. Right.
Because it's like 0 today.
Yeah.
And therefore, you might also look at light therapy boxes, which are becoming much more available and reasonably priced, that can work to actually extend our body's perception of the length of the day, which becomes like moving toward the equator.
So explain these light therapy boxes to me. So I've never heard of this before. What is a light therapy box?
Okay. It is a full spectrum light that is put inside of a clear or translucent plastic box, so that rather than shining on something like a regular light would shine on a table, it's intended to shine on the person and therefore create that effect of having a longer day. So it's very commonly used where a person will have it in their home. They'll get up early, it's still dark out, they'll turn on the light therapy box, and then read the newspaper, eat breakfast, etc., and thereby extend their perceived length of day by an hour or an hour and a half. Then they go on into the regular day, hopefully still get outside, get some exercise, and then in the evening, as the light diminishes, they're going to get sleepier and hopefully sleep well that night.
So it's basically sort of extending the daylight in their day, even though it's artificial daylight.
That's right.
And this is a matter of, it's not just a regular lamp that you can shine on yourself, right? It has to be a certain type of bulb.
The idea, I believe, is to use a full spectrum light and use it a very bright light, and I don't know light measures very well, but these are extremely bright lights, and so that it begins to have the effect of truly being outside.
Now, I can just imagine that some of our viewers are thinking, you know, a light therapy box. It sounds a little hokey to me, but these things actually help people, right?
They very much do, and it kind of proves out that what's happening is that our bodies are, and the bodies of some people are particularly sensitive to the length of day, so that as that light diminishes, there can be feelings of sadness and disinterest to the point where it's really worthwhile for them to seek some treatment, whether it be light therapy, talking to their provider about antidepressant medications, getting out more, exercise, all really are very helpful.
You know, you mentioned counseling as well. Let's say I've been feeling very depressed for several months. I come to you at Mayo Clinic Health System for my first therapy appointment. What should I expect as a patient in therapy?
I think the first thing to be aware of is that, you know, people are often encouraged to make a list of questions and things like that when they go to their regular doctor. That is not at all necessary when you go to a counselor. In fact, you don't have to worry about the questions or knowing the right thing to say. The counselor will take care of that. The first meeting is, you'll probably be getting a lot of questions on what's happening and how you're feeling, but the intention is to build a better sense of what's happening and what the problems are, and then secondly, you and the counselor together begin to work on a plan of information about the depression or whatever the problem is, as well as a plan of action, some interventions for you to take that will make a difference. The counselor is there in some ways like a friend, but also like a consultant, someone who knows a lot about behavioral issues.
It's like a friend you can talk to that has lots of expertise on whatever problem you're having.
That's right, and I actually have spoken to several people who said, I decided to come in because I didn't want to wear out my friends. There are some issues that going to someone who is not a friend and has to bear with it is a perfectly good thing to do.
What are some ways to help prevent seasonal affective disorder during the winter? We talked about the light therapy box, but there's got to be some other just general things that you can do to help.
I think a lot of it is just awareness for what's going on. So that having an awareness that if a person is feeling kind of down and dull, that we can turn that around. And there's a lot of ways to do it. Number one is just making your environment sunnier and brighter. So open the blinds, sit closer to the window, get outside, and not only get outside, but become more active. Many times, we find that depression gets fed by some of our activities. And in fact, depression could be said to encourage activities that will leave us depressed. For example, not going out with friends and staying home and watching TV. When we want to change our environment, we want to do those things that depression would not approve of. So it's being social, being active, being in a bright environment. And if that is not really curing it, then realize that you may need to take the next step. Talk to a friend, talk to family members, talk to a professional. Because there are both medications and other therapies that can be very helpful.
All right. Well, unfortunately, we are all out of time, but I'd like to thank our guest today, Meg Stump, behavioral health provider from Mayo Clinic Health System, for joining us today on Speaking of Health. Thank you, Meg.
You're quite welcome. I enjoyed being here.
Have a great day, everyone, and be healthy.